Dr. Alok, I would like to ask you that, what are the changes that you foresee in the healthcare sector, especially when the third wave is predicted, whether it's going to come or not? Of course, we'd like your comment on that. What are the changes? That is something that everybody would like to hear.
So all current data suggests that some parts of the country are in the third wave, right? But the third wave, traditionally, we've seen past pandemic data, third wave is usually lesser than the first and the second. So we have a low level of third wave already in place in places like, say, Maharashtra and Kerala. And North is virtually free, but ultimately North will also pick up. So the third wave is here. It will be a muted kind of wave, and it will continue for some time before it goes away. What will healthcare institutions do? I think they're more or less working the same way, unfortunately. The only thing which has changed is that people, the patient, as well as the doctors, have become more sensitized to remote medicine, telemedicine, at-home care. So new business models, new use cases are coming up, and they will continue to pick up and continue to become mainstream. Hospitals are getting back to their old business, right?
Dr. Alok, the healthcare workers, it's been a very, very big topic ever since COVID started in India. And for the upcoming wave, if I were to ask you, how is Omni Hospitals preparing for the upcoming wave for the healthcare workers specifically? Are there any initiatives planned for that?
See, we were already prepared. Mehul would be knowing we have a long-running meditation program in the hospital for doctors as well as for staff. That reduces the amount of burnout that you have. It has been proven all across the world. If you meditate regularly, you're less likely to get burnt out, right? COVID was just a very big stress. It was producing more burnouts. We always encourage at the HR level, encourage people to take leave. Mehul also knows that. He has worked with me. I never say no to leave. That's always I tell my leaders, this is the only thing you can get to a staff person who is working under you. Speak kindly to them, give them leave whenever they want. Nothing waits for somebody. No organization will stop just because one person went in. You chill out. You go back, chill out, and recharge yourself. Unless you recharge yourself, how can you give to others, right? So we have this, if I see one of my senior officers, he hasn't been on leave for some months, I said, you've been working 2 months. We need to go out. Take off. Next 1 week, I don't want to see your face.
But Dr. Rashmi, there's a lot of fear of uncertainty. There is a new fear called the fear of uncertainty. There's a fear of job loss, of course, but the fear of uncertainty, no matter whatever mental wellness techniques you employ, of course, everybody goes through that fear, and especially going through it in these post-COVID phase 2 times. How do you combat that? Well, what's your comment? What's your take on that?
So there are two ways, you can actually, address your question: the fear of unknown, or the fear of situation which you might. I have not, in fact, I would say that if you are leading a very balanced life, and your employee and your employers are comfortable in actually accommodating, because everybody, whether it is the top guy or a person who is a newcomer in the organization, is actually in the same environment. So nobody's living in that isolated environment not to understand the whole homogeneous understanding. And this is the first time that I have really seen which, apart from organizations, the government is very proactive. The schools are very proactive. In fact, the child, whose parents are working with us, their children are actually so much more well aware. In fact, I'm extremely happy to understand the discipline of the country. Otherwise, it would have been extremely difficult for any one of us to control the pandemic if it wasn't for the self-discipline. And in fact, we keep cribbing that, the things are not moving well, or things, whatever. But that fear of unknown has made us more disciplined. They are now, where people are ready to understand. It was there. All these good things were around us. It's not nothing that yoga or meditation or the good lifestyle or healthy lifestyle has just come up. We have become more receptive to take them. And that has actually got into a better space for everybody to live with. And that coexistence with a good life, and that's exactly what we're encouraging in our office and in all our offices. Be sympathetic and be patient. And that's what we had actually lost a bit pre-pandemic. We were all very impatient. We're just trying to actually just get to reach some targets, goals, reaching somewhere, and so on and so forth. Now that whole possibility of reaching out to all of you on a VC has actually saved me so much of time. I can multitask better. So in fact, my work efficiency has increased. And it has become more productive in spite of the fact that my time, money, and energy is getting much lesser. So that has automatically created a very synergistic environment around. So how do you actually utilize the best time that you have saved is where I'm sure your panelists are, in fact, the nutritionists, the people who are into meditation like yourself, and you started with such a fantastic thing. In fact, if you would ask anybody in the usual say time that, okay, you close your eyes for 5 minutes or 10 minutes, those 5-10 minutes wouldn't pass. But now we are very happy to do that. And we are looking forward to do that. So that self-introspection has been forced on us, but it has been adapted very happily with all of us. So that's all what I need to say.
Dr. Bhavna, the points that Dr. Rashmi just mentioned, the fear of the unknown, you're the best person to actually take that forward. What's your take on that?
Thank you, Shagun, for inviting me here on behalf of Heal in India. I'd like to congratulate this very wonderful webinar that is being organized. And I really want to start by saying that I loved what Dr. Alok Malik said, that smiles are so essential, whether it is dealing with the present or whether it is dealing with the future. So I think there are reasons why we need to understand within ourselves why we need to smile. And I think the moment Dr. Alok actually mentioned even the smile, I was looking at you, Shagun, and as always, the beautiful smile evolved. And I think that is the first thing that I want each one of us to understand, that whether it is the present or whether it is the future, there are going to be reasons for us to smile. So number one, if we can actually keep a gratitude journal, which we can start in the morning, you will see that you have so many more blessings in the present that you can take along with you in the future as well. That is a very good way to start with not only dealing but coping with the fear of the future as well. And definitely in these times, the future is unpredictable, which can cause worry, can cause fear, which is natural. So number one, don't try to be superheroes, but embrace that yes, stress prevails, but yet there are things that are within my control. A lot of times when we try and work towards things that are beyond my control, we will be wasting a lot of our productive energies. So one, let us identify what is within our control. So very importantly, in such times, we should try to ground ourselves and to reconnect with what the present lies and what we anticipate the future is going to bring towards us. Try to rationalize your thoughts, like asking yourself, what is the probability of this XYZ actually happening to me that I'm anticipating? And try to focus on what we can do to prevent it from happening and appreciate and utilize the strengths you have in the present. And what else can you build up as your skills or as your, basically your skills to empower yourself to be able to face the future. And some of the things, like I think Dr. Rashmi very beautifully mentioned and Dr. Alok mentioned and you've been mentioning, are things that ground you, which are very important, like meditation, like relaxations, like deep breathing, like doing gratitude exercises at night before you go off to sleep. All these things are only going to make you get more and more empowered, get more and more prepared for what the future lies. And thereby, when we are preparing ourselves for what the future lies, we don't anticipate only fear. We also anticipate that things are going to get better than where we are today, because that is where our thought process is taking us. Today is good, and my mind is going to take me to make it better. And thereby, I'm working on my present I'm working on myself, and I'm working on empowering myself and all the resources around me. And I really like what Dr. Rashmi said, that each of us as an employee in our organization should also treat the other one like a family. And that's when also the future on the corporate front becomes much more easier for us to handle.
Ms. Nazneen, I'm moving to you first. Hypertension, what's your take on that? And how to combat hypertension?
Okay, so thank you first of all, Heel, for this fantastic initiative, and Shagun, you've been great, connecting the dots. And I think hypertension, in today's time, it is one of the most silent killers. Okay, most people are even unaware that they have an elevated BP unless and until they go to a physician and that gets checked. Today, these days, fewer people go to family physicians. They straight away jump to super specialty doctors. So that in between family care physician, which was there, who would always check the BP, that phenomena is also slowly coming down. And so that's something which, today we have a lot of handy machines, and I think every household should adopt one, and at least it may not give you the exact accurate readings, but by far bring you closer to it. Second thing is, our food and our diet is something which directly has an impact. The WHO has a recommendation, a clear recommendation of not more than 5 grams of salt per day. But, through COVID times, through the pandemic, and otherwise as well, as Indians, we love salt. We love sweets, but we also love salt. And, an average household Indian consumption of salt is nothing less than 12 to 16 or 18 or sometimes even 20 grams of salt. And so that is something which we really need to kind of, keep under control, because today we know that salt also has many deleterious effects. And more than that, today whenever we talk about hypertension, we talk about this beautiful diet called the DASH diet. Okay, so that's dietary approaches to stop hypertension. So all that it includes is eating a high fiber diet. So make sure that you are at least eating your, eat your rainbow is a beautiful term to remember. So at least make sure that in your plate you have around 5 to 7 colors through the day. 7 are difficult to achieve because the indigo and those colors, are rare, but at least 5 through the day, can be easily achieved. So with that, with your fruits and vegetables will come your potassium, your fiber. Both of them will help you reduce your hypertension. Okay. Also, eating a variety of food also today, when we talk about gut health, and I'm just mixing gut health with hypertension here, is we talk about eating a variety in the diet. Okay. So eating as, today a lot of, we talk about dietary diversity, means don't eat the same food. And in the pandemic, because of, restricted resources, people kept eating a lot of, ready to eat, preserved foods, which are all right to some extent, because that is an emergency. But otherwise, you need to diversify the food. So 30 foods for the week, which is not difficult. Like if you have 2 fruits a day and 2 vegetables and your pulses and cereals, multiplied by 7 days, 30 is an easy number to achieve. But we need to have different kinds of foods, which will all help us to reduce, the hypertension overall.
I'd like to ask you that productivity at work is definitely linked to food intake. If we were to sum up, the conversation that we were just having. So managing your diet while you're working is an important part of the corporate structure. Your take on that, Ms. Manju?
Yeah, of course, productivity is directly linked to what you're eating. But to put it simply in one line would be that what fuels your brain and fuels your, neuronal connections is good fat and fiber. It's the carbs that slow you down. So because Indian food is mostly a mix of all forms of simple carbohydrates, one of the simple things to improve productivity is to reduce your load of carbs. which cause you that brain fog, that sluggishness, that low productivity, and build up on the other macros, which are, of course, fiber, fat, and a little bit of protein, and correct the micronutrient deficiencies. That's an easy way of, building up your productivity.
Absolutely. And Ms. Manjari, you think if we move to the other side, where it is important, where you have to take care of all your employees and ensure that they are eating well, what are the steps that you recommend? Because a lot of people like processed food. A lot of people say they're very busy and their lack of time, and that's why they're living on sealed food. So it's a question. It's a very, very important question, I think, which Ms. Manjari, we'd like you to take this forward. What is the solution to this?
That's right. A lot of people think that they have to depend on processed food or quick to eat food because they are short on time and they have, the resources limit them to that. But I believe that this is more a perception. It's less really the reality, which means that we choose to eat these foods because they're easy to access, more tasty, more rewarding, because they highlight the pleasure centers of our body. However, cooking your meal is not just an activity for health. It is also, as Nazneen also said, in our cultural practice also, our own food is part of our setup, is part of our life, and live food has Jeev Atma in it, we can say. For example, one of the things that we try to keep telling people is to eat fresh food and not eat out of a refrigerator which has no life. Now, how do you think eating out of a packet which has been made in an industry maybe many months back is okay? It hardly carries any life or life force with it. Yes. So I think one of the reasons why people eat that sort of food is not because that is their only option. It is because they do not understand or are not told how important it is to move away from them and to start doing that small endeavor of eating real food and fresh food. It's really not such a big thing. It's just a little bit of management, a little bit of consciousness, a little bit of putting the things in place. Sadly, there is no other option. We do not have an option of eating anything unhealthy. We only have a healthier option. And healthier comes from our kitchen, sadly. So we have to get back to our kitchen.